When it comes to disorders that are more commonly identified, I hesitate to use the word diagnosed, in adults, depression and anxiety disorders. The less common, but absolutely devastating, schizophrenia, that's a prevalence of about 1 in 100. Bipolar disorder, it's become increasingly common for reasons, well, probably manifold. Again, they're descriptive, they're based on behavior, nothing to do with etiology. We have no objective markers, and in fact, we already know that you can arrive at the same, if you like, final common expression of these symptoms by a lot of different routes. So individuals differ. Each of these labels conceals so much variability that attempts to group all, let's say, individuals with schizophrenia together and then to look for anomalies reflecting, let's say, sensitivity to A2 milk, they're doomed from the start. But this doesn't mean that some of the individuals within these categories, we've got to start looking better at biomarkers. The overlaps, again, between all these conditions are incredibly high. I also want to flag up, because this really matters, that the mental health disorders have now overtaken the conventional physical health disorders that we're so worried about in terms of their cost burden in developed countries, and that's ignoring the individual suffering involved. It took quite a long time to get an answer to the question we asked the UK government, but back in 2007, £77 billion a year. That's more than heart disease and cancer combined. And if you look at that increase in just 3 years, we haven't got more recent figures out of them yet, I'm afraid. And then this paper, published in 2011, looking at the state of things in 2010, it's now 38% of the entire European population in a given year has a diagnosable mental health or neurological or psychiatric disorder. Now, you may start to think these diagnoses are getting out of hand, but if we break it down, I think you can begin to see a little more plausibility here. And let me emphasize, the individuals, the majority of them, didn't even know that they had a diagnosable disorder. These figures were arrived at by compiling the best data available from epidemiological, clinical, and other studies. And certainly most of them weren't receiving treatment. But when you look at the range of conditions here, mental health conditions, very prevalent, big burden.